Welcome back to another podcast of Heal Without Harm. I am your host, Dr. Clayton Dir, physical therapist, and today we've got my colleague, Dr. Allison Bullinger. She has been with our clinic at Natural Wellness Physiotherapy for 2+ years now, and she has started to get into her own little specialty that is much different than mine. We can still help out pretty much every person that walks through the door, but certain people go to her, certain people come to me, and I would like you to learn a little bit more about her practice, how she got here, and some of the problems that she's trying to solve in her practice with the medical system. So, Allison, welcome.
Thanks, Clayton. I'm happy to be here.
I'm really happy to have you on. I'm happy to essentially have more people learn about the different PTs that we have here at the clinic and the different ways that we can help people. One thing I do want to touch on later on that I want to make sure we get to is vertigo and dizziness. And so I don't have that written down on the script or the outline that we want to cover today, but hopefully we come back and remember to get to it. Let's start out with Allison. What got you into PT school? What told yourself that this was the job for you, and walk me down that path?
Yeah, Clayton, I feel like I have a very basic story getting into PT school. Like 50% of the kids there, I had a big ACL injury when I was in high school. I played multiple sports, so I got to go through a good 6 months of physical therapy myself, and I loved my physical therapist. I loved my experience. Being active and playing sports was a huge part of my life, and so it was really important to me to rehab well and get back to it. So that was my first exposure. I also got to see my grandma go through a bunch of physical therapy after she had a series of strokes when I was in high school. So that just saw it in a completely different realm. Neurophysical therapy is nothing like post-ACL rehab.
It shows a vast difference where they're both technically physical therapists, but man, are they different in what they do with the patients.
Right. It's wild that we all go to the same schooling.
Mm-hmm.
They're doing such different things. But then I got to college. I went to K-State, go Cats. And for a long time, my first couple years, I actually thought I'd be going to medical school. I could kind of set myself up where I was a CNA, a certified nurse assistant, so that I was getting hours in that if I wanted to apply to medical school, I could. If I wanted to apply to physician assistant school, I could. Or if I wanted to go to PT school, I could. And at the end of the day, you know, I worked a series of jobs as a CNA through undergrad, some in the hospital setting, some in like long-term care settings, some in memory care settings. And so I got to see the medical model and the medical system a lot through that. And I kind of noticed a lot that you can look at these people and you can give these people medications and you can keep them alive for a long time, but that quality of life is so poor for a lot of them. You know, they might spend 10 years barely getting out of bed. The only thing they're doing is going down to the dining hall to eat, if even that.
A phrase I've heard is almost like prolonging death.
Yeah, pretty much. Yeah, a lot of people talk about, you know, lifespan versus health span too. Mm-hmm. Your lifespan is how long you're alive. Your health span is how long you can enjoy your life. And so that was huge for me. I don't want to just be a medical provider that's keeping you alive. I want to actually improve your life and serve you in that way. So physical therapy was definitely a lot more that realm. I did a series of following different types of medical doctors and physical therapists and all of the things just to make sure that I actually wanted to do this before you go to school for that long and spend that much money. But yeah, I ended up here. I just fell in love with physical therapy more so than all the other things.
Do you feel like it was physical therapy was ruled in because of stuff you saw or experienced, or do you feel like you almost ruled out other occupations like medical doctor or that nurse practitioner and stuff like that?
That's a good question. It's probably a combo.
Yeah.
You know, a combo of seeing some of the medical systems in these medical doctors' lives. I was like, ooh, I don't know that I want that. And also that I just enjoy being active in everything that comes with physical therapy on that sense too.
Yeah. I see what you're saying. So you get through high school. Were you doing a CNA in college as well? Did I understand that right?
Yeah. So I got my CNA license early in college, and then I worked through undergrad as a CNA.
Did you do 4 years at K-State?
Yes.
When at that point in time, like what grade were you like, you know what, physical therapy is the one for me. That's what I'm going to go ahead and aim towards.
It was between sophomore and junior year, probably. You know, at the end of junior year is when you have to apply.
Yeah, you're starting to really lay down
the
path.
It was really probably end of sophomore year that solidified what I wanted there.
Did you apply to multiple schools?
Yeah, I applied to 5.
Oh, wow. I only did 1. I didn't know you applied to so many.
Well, when you go to a big school like K-State and you're sitting in these giant kinesiology lecture halls, and they're like, who here is going to be a physical therapist? And 200 people raise their hand.
That's intimidating.
Yeah, and you know that, 20% of us get in? What
I don't even
percent?
know if it's that. I'm pretty sure my class was 330 to 350 applicants and 40 get in. So that would be just over 10%. So you see a bunch of people that don't. It also amazes me how many people, not to be rude, but like that are like totally not qualified, but apply. And you're like, okay, that makes me feel a little bit better because this dude is like a 2.1 GPA. So if he's applying that means there's a good chunk of those. But then you also get intimidated by like the girl next to you or the guy next to you, or who you know as like a 4.0 is volunteering for this, the captain of that, the president of this, and you're like, yeah, I can't compete with that either.
Right.
So you decided on PT school, applied to 5 schools. I don't even know of 5 that are close. Do you remember the ones you applied to?
Wichita State, Creighton, KU, St. Mary's, and Rockhurst.
Did you get into more than just one?
I got into Creighton originally. Creighton does rolling admissions,
Okay.
so I found out before my senior year started
Well, that's convenient.
that I had gotten in there.
Yeah, because WSU is like a 3 to 6 month wait after you apply.
Right, yeah. So you go in an interview, and then each section of interviews, they accept a certain number of people. So
Okay.
found out I got into Creighton early, and then I got called for interviews at KU and St. Mary's, but I had found out I got into Wichita State prior to those interviews, so I ended up canceling them.
Okay, so you don't know whether or not you would have made it in.
Yeah.
Gotcha.
Mhm.
What made you pick WSU then?
A big thing was the price tag.
Oh yeah.
At the
Yeah.
time, it was a good $25,000 cheaper than
For the
next
whole school?
cheapest school. Yeah, for all
Yeah.
3 years.
Okay.
Creighton was literally 4 times my
Are they
WSU
private?
tuition. Yeah.
Okay, plus out of state, which
Right.
probably plays into it. Good Lord, that'd be a lot.
So that, and my family's here, and so being able to be close to family and
Yeah, that's something that's really important to me, and it's gained importance significantly as I've grown a family, and I know family's huge for you, so it was probably very convenient to get in here and be able to stay close ultimately. So you get into PT school here at Wichita State. We talked to Jake a little bit on a previous podcast about clinicals. So talk to me a little bit about if there was there any frustrations you had during like taking classes, or was there writing on the wall of like, this is a little bit frustrating, maybe we could do it better? Or did some of those revelations not necessarily take place until you got out, until clinicals?
yeah, good questions. I think my PT school experience is a little bit skewed because I was a COVID class.
Oh, yeah.
And so I only had 1 or 6 months ish of normal PT school experience. And then it was a solid 9 months before we met back in person.
Okay, so real quick. So PT school is 3 years, starts in the summer, ends in a spring. So you have summer, fall, spring times 3. So you said you have 6 months. So you started in June of
I guess
19?
Yep, of
Okay,
19.
so
So I
yeah.
had that normal year and then.
So you had summer and fall normal, and then the world ended kind of
Yeah.
at the very beginning of your spring semester. So yeah, it was smack dab in the middle.
Mm-hmm.
Okay, so sorry, go back into Revelation. So you weren't normal necessarily in regards of the classing that you had, but go on.
Yeah. But I think a lot of my frustration in the coursework was just me asking why, right? We get told all of these things. That's just like the framework of PT. Like, yeah, you see them 2 times a week for 6 weeks, blah, blah, blah. And it's like, why?
Yeah, don't ask questions. That's just what you're supposed to do, right?
Yeah, like nobody can answer those questions. Like, why do we do that? Why is that? That's just how it's been. But there's a lot of things like that. And, there'll be things like, I remember one time our class was having an argument because people were saying like, you should never bench press until you can do a solid push-up or like 10 solid push-ups. There was some number. And I was like, I can't do a solid push-up unless I'm like consistently training it, but I can go bench press lighter weight. And so we literally were getting out. I got my calculator out to show that like, even if I'm doing a push-up from my knees, like the percentage of my body weight is way more than me grabbing 20-pound dumbbells and doing a good solid bench press through a full range motion.
Yeah, no, I fully agree. Just to tail on that, I remember one time I put my hands on a scale and did a push-up, and it was right about 80% of my body weight is how much force was being delivered through the scale. So assuming that's correct, if you weigh 200 pounds and you do a push-up, that means that you're essentially doing a 160-pound bench press. Well, if you can't do a 160-pound bench press as a 200-pound person, then you should bench press or dumbbell.
Right.
Because the push-up is too heavy for you. So yeah, I'm in agreement with you on that argument.
It's just a lot of little arguments like that I'm just like, why? Why do we do that?
Mhm.
Why are we teaching that? What's my brain needs a purpose. Otherwise I'm not going to grab onto it. And so a lot of asking why during PT school. But you learn a lot that way, and everybody in the sense does too. But a lot of times I think you don't have time in a lot of medical settings to ask the question why. You just have to
provide the answer and move on.
You just have to follow the algorithm or provide the answer, give them the best you know, and then go see your next patient.
And I think that was a big sale for me on PT was with my experience as a consumer of the medical system, I didn't get to spend that much time with my doctor. I loved my doctor. I never actually had to use him that much though, so I don't know how he would have been if I had big problems, high blood pressure, cholesterol, all those things. But I enjoyed him as a person, but I never got more than 3 minutes with him. And so when I was trying to pick what I wanted to do, time was part of it because PTs, as we know, usually get at least 30 minutes with a patient at least once a week. And then, of course, in our practice, we are able to do more, but you got that time availability to ask those questions. Why, like you're referencing. So there's some frustrations there. And of course, I know your schooling was different, but when you went out to clinicals, what all clinicals did you go to or what facilities did you go to in settings?
So one of our clinicals was completely canceled due to COVID. And so I ended up with only 3 different settings. One was a skilled nursing unit. So that kind of transition between hospital and people going home. A lot of lower level stuff, just getting up, getting out of bed, going and doing things like that. Then I went and did just a standard outpatient physical therapy clinic. So seeing a lot of total shoulders, total knees, ACLs, all of those surgeries and things that you typically think of when you think of outpatient physical therapy. And then my last one was here at Natural Wellness.
Yeah. And yours were a little bit different. Were all of yours super long or was it just the last one?
The last 2 were super long.
Okay. And was it 14 weeks?
Yeah, 14 or 16.
Yeah,
something
traditionally
like
10. So 10 to 14 don't sound that much different, but then you realize it increases by like 40%. So yeah, that was quite long. Okay. So did the skilled nursing setting ever interest you, or was that kind of when you had to get through?
I was very comfortable in that setting because of my CNA experience. Mm-hmm. I spent a lot of time working in settings like that, so it was very comfortable for me. It didn't often feel very different than being a CNA though, just because you're the first person that's maybe got them out of bed all day, and so instantly they have to go to the bathroom. You're sitting with them on the toilet for 30 minutes of your PT session, right? Especially if there's not a nurse aide or somebody else to come help. And so that's a lot of what I already did as a CNA.
Yeah, I see what you're saying there. Especially if, even if there was a CNA, like you still have a schedule you kind of have to stick to. So
yeah,
it's hard to do much more than, okay, today we got on and off the toilet and that was your physical therapy.
Right.
Yeah.
And so I enjoyed it. I don't have any, it wasn't something that I was like, I do not want to do this. I was very just comfortable.
Yeah, it was fine.
Setting. I didn't feel like I had to or got to apply much of the knowledge I learned in the PT setting.
Yeah. So then moving down to the outpatient, was that here in Wichita?
Mm-hmm.
Okay. So at an outpatient facility here in Wichita, you saw, like you listed, a lot of post-surgical stuff. What are some things you really liked? And then what are some frustrations that may have came up throughout that clinical?
I really liked just the variety of stuff that you get to see. Yeah. I guess that's always good.
How many patients would you see in a day?
This clinic was one-on-one. There was no techs, no aides. So we saw 8 to 10 patients a day, maybe. And it was one-on-one. So it was better time than a lot of the outpatient clinics around. But yeah, it gets repetitive a lot. I feel like you don't have to think and problem solve quite as much when you're doing post-surgical stuff unless there's a problem popping up, just because there's a protocol you follow.
Out of all your patients, if you had to get a rough percentage, how many of them were on some sort of protocol post-surgical?
At that clinic, probably 85%.
Okay, the majority of them. So people aren't coming to you saying, hey, my back hurts and I don't know why. It's instead someone coming in with sutures, post-surgical, and a protocol is handed to you by a surgeon saying, follow this.
Right. They already have a diagnosis, just taking them through the rehab process.
Okay. So what I really like about PT is I tell people playing Sherlock Holmes or detective and trying to get down to what's going on. And I remember I was at a clinical in Mid-America Orthopedics and I had an evaluation and I almost didn't know what to do with myself because we knew it was wrong. You just had surgery. So I came in planning to ask all these questions all right, let's get down to the business. And it's just all right, you had shoulder surgery. Let's move your shoulder. And so the entire first 20%, 30% of the evaluation that I had mentally planned just wasn't necessary because we knew exactly what was happening. It really threw me off. And so I realized I would not do good in a post-surgical setting pretty quickly. So the benefits of clinicals is going and doing those things. I want to reference the more traditional, like what we call like PT mills, that I know you have some friends that have worked at. And so at bigger clinics or more corporate ran clinics or clinics in bigger cities, can you give me the lay of the land on what some of these PTs are having to do or the culture that they're having to work in, like how many patients they see in a day, how much time they get with their patient, what that looks like?
Yeah. One of my friends in particular worked at a clinic where I think she had 3 or 4 PTAs working under her. And
Which is a physical therapist assistant, right?
Yep, an assistant. So the PT, the physical therapist, is the only one that's allowed to do the initial evaluation and progress notes and discharges, but your assistant can treat them in between. And she literally one day had, I think, 7 or 8 evals in one day. And so she's just like pumping out evaluations, which has a lot of paperwork with it as well.
And a lot of thinking. And like it's exhausting mentally.
Yes, getting to know somebody new. But then she never gets to treat these people or follow. They just go out to the PTAs. She's just pumping out evaluations and new patients and then doing progress notes, and never actually getting to take these patients through a full plan of care, which is super frustrating. I mean, if you're not doing an evaluation, you're double booked at least. So you're treating 2 clients at the same time with completely different issues. It was just a lot of volume, a lot of stress, never really getting to get to know any of them or treat them how you want to treat them. And
that's an example too. And this is where my frustrations go more towards medical system, because I'm sure your classmate was an amazing person and really wanted to make a difference. But when you have the parameters like that you're strapped to, like, what can you do? That's how I feel, right? Like, you want to give this person your time, but you have someone next to them also that you're having to physical therapy. You have an evaluation in 5 minutes that you have to get ready for. Then you have to pass them off. So you have these really good providers and these people that mean really well, but that are stuck in a system that doesn't allow them to be themselves. And that's what's frustrating to me. And for anyone out there listening, this is fairly common. And if you notice that you're in a clinic like this, as a consumer, I would highly recommend getting a second opinion at a different clinic, regardless of quality of the specific physical therapist. Because if they're strapped for that, they can only do so much by you. And so if you can find a clinic that is more like Allison's experience in one of her clinicals, where it was still one-on-one, 7 or 8 patients a day, you're getting 45 minutes to an hour with this PT, as opposed to splitting the 30 minutes with a second person, where that PT can't even keep their brain with you because they have so much paperwork stacking up or so many more evals before and after you. And so continuing on, what were some things that you noticed as a difference between not this PT mill, but the clinic that you were at, where you saw 7 or 8 people a day, mostly post-surgical? What were some differences that you noticed between that clinic and when you came to natural wellness?
A lot of the motivation that the clients have too, right? The people at natural wellness that come in these doors like want to get better and are very motivated. Sometimes the people that are coming into those other clinics, not that they don't want to get better, but almost a little bit more hopeless, I guess, because a handful of them have been told, like, you have to go fail physical therapy first before we're going to give you your injection or your MRI or whatever you need. Or, you, like, this is the surgery, like, this fixed the problem, but you have to go through physical therapy. And they're like, I thought the problem was fixed. Like, they don't understand why they're at physical therapy. They either don't want to be there, don't know why they're there, don't know why it's important, those kinds of things. Versus at natural wellness, people come in and they have a problem and they're like, please help me.
Yeah. And they're willing to take ownership of it. Like, what can I do about this to make it go away?
Right.
Sure.
They're excited to be here and bought in, which helps our job as well.
It does. It makes us stay happy and motivated. And if you look into like, I can't think of the term, but there's certain activities that fuel you and there's other ones that drain you. And when you're able to have patients coming in that are motivated and they get results and they do what's recommended, it's a very fueling thing instead of a draining thing. And when we reference your classmate that was in that 15, 20 patients per day clinic, that's quite draining. So it's hard to keep showing up every day and bringing the best when you're just going to get beat down by the system that you're in. There was one other thing, when you talk about patients who are either hopeless or they think PT is just a step stool to surgery. I literally had a patient at one of my clinicals. She sat down and she was already like, we're going to use the word grumpy. The second she sat down. And I was very grateful. My CI was somebody that could talk very plainly and sternly to where he could say stuff that was almost to some maybe perceived as rude, but he said it so flatly that it was just a statement. And he was trying to get to the bottom of like why this lady was here, what she was trying to get out of it, and seeing where she was coming from to see how we could motivate her to do stuff. And it didn't take that long, and she was really getting frustrated because he was clearly not delivering what she wanted. And she just goes, how many more of these do I have to come to before I can get my MRI? And I was like froze. I like had no idea what to say. Granted, she wasn't talking to me, thankfully. Thankfully, it was early enough that like my CI was still like running the show. But I was just like flabbergasted, and I don't even know what he said back, but it was just like, okay, your motivating factor is not to contribute anything here. It's just like showing up enough times to go get the MRI because she thought that was the answer. And nowadays I would probably try to not talk her out of it, but like get to the bottom of like, why do you think that? Because most of the time MRIs don't show you what you need to see, and they don't really show the whole story. I mean, I think that would have been useless with this gal, unfortunately, but when the motivating factor for the client walking in is that like we're kind of set up to fail as PT, right? Because we have to have buy-in, we have to have like them doing the recommended exercises, stretches, whatever it may be. And then another story on that was a work comp case where I swear every time she came in, we fixed her problem, but yet the pain was still there or it would change a little bit. And then I come to find out that it actually wasn't work comp. I apologize. It was a car accident. And I started to learn the back of house type stuff where essentially, I may be incorrect on this a little bit, but the larger the bill they can run up, the more money they may profit as the person who was hit by the car. So she was in a pretty bad accident, but the way I understood it was however much the medical bills are, you take that times like 1.5 or something like that, and that's how much they would get paid for like pain and suffering afterwards. And so if they know that's the motivating factor, they may not want to get better, and they may want to kind of just keep going through the loops because they can get more cash. And so anyway, a little rant on the challenges of work comp and motor vehicle accidents. So moving a little bit forward, I want to start talking about what is your ideal patient, Allison? Like, you've had plenty of reps now to where you've seen a bunch of different varieties, and it seems like you've settled in quite well with a couple different groups of people here around the Wichita area. So if you had to list out 2 or 3 different clients that you really just enjoy working with, that really fuels you and that you really vibe with, what are those people doing, or who are those people?
I love my runners.
Okay.
We know that. We call me the running specialist at Natural Wellness. So
for sure. I don't like running, so I'm glad you took that on.
He did just run his first half marathon, though.
I still would barely identify as a runner. I did the thing, but I don't know.
I love my runners. So I see a lot of those, and with running typically comes lower body injuries. So
okay. So anything like hips, waist, and down?
Yep. Hips, knees, ankles, Achilles tendonitis type stuff. So see a lot of that. Otherwise, I just like the variety that I get to see on top of that.
Yeah.
Active people that want to be active, that are involved in various things, so they need to be able to move.
So if we had to just, I think from the outside looking in, the 2 people that I see you seeing the most is runners, and then I've forced you to become a vertigo specialist, so we'll get into that next. But what are 2 or 3 of the most common groups of pains that runners are going to have?
Hip stuff.
Okay.
Are very common. Knee stuff, or like IT band syndrome, you'll hear people call it. And then calf Achilles things. Sometimes heel pain that people will call plantar fasciitis. It's not plantar fasciitis.
And no, you don't need an orthotic. So let's dive into the hip. What are the common hip pains that pop up, and what are a couple things you do about it?
A lot of times it's just overuse in the hip with my runners, because they've either gone from running 0 to now they're running 25 miles a week because they have their race coming up.
That's a lot.
Yeah. Too much, too fast. So it's an overuse thing just in the muscles and those tissues that we just have to grade our ramp up. Like we need to slow down how quickly we're getting into those miles. For my people that are regular runners, a lot of times it is they need to feel better or do whatever. I can't believe how many people are out here running marathons not eating any food
Like for that whole 3, 4,
for
5
the
hours?
entire, yeah. I'm like, do you know how many calories you're burning out here? You would feel
How many
amazing.
calories do you burn? Like, just ballpark me. Like, if you're running a marathon, how many calories do you think are getting burnt up?
They say a standard is like 100 per mile.
Okay, so 26 miles, 2,600. There's people who don't even eat that in a day.
Yeah.
In general, and these people are burning that much in 4 hours.
And not eating, and probably not eating enough after either.
That's pretty intense.
Leads you towards injury for sure.
Connect those dots for me. How is me not eating enough food during a race going to lead to an injury?
We think about injury, right? An injury is just where the load that you put on your body, when we're talking about, especially runners, are typically overuse injuries. And so overuse, everybody always thinks that means I need to decrease my volume. Like that's the only thing you have to change. But an injury, an overuse injury, is just the load you put on your body exceeded your tissue's capacity at that time. Your tissue capacity, so how much your body can handle, changes based on a lot of different factors. How well you're fueled changes how much your tissues can handle, how hydrated you are, how good you're sleeping, how, like, if you're stressed or in like a sensitive, like emotional state, your body can handle not as much activity and load as it can in a standard kind of good week. And so all of these things play a role in that, which is fun that we get to touch on all that stuff here, right? And, you can hear that, and even going through school, all those things, you hear people say that all the time, like pain is complex, like all of these factors play a role, but until you experience it yourself and see patients, on the other side of you that see it actually making a difference, you're like, oh, that's real. I have my one client that we were making slow progress, and I finally asked him a few weeks in, I was like, how much water are you drinking? Like, we're going to touch on these pillars of health now, because you should be better than you are right now a few weeks in. And we got down to the water thing, and, they're only drinking water 2 days a week. That was it.
2 days a week.
2 days a week.
How much water was on these 2 gracious days of hydration?
I think it was like 3 or 4 of those like 16-ounce
Okay, like the
water.
throwaway water bottles? Yeah.
That is not near enough water. And so that was their homework for the next week, was I want you to drink some water every day. And, they come back and they're like, my pain's decreased by like 50%. It's like, yeah, we have to fuel our body. If our body isn't fueled, hydrated on a baseline, it's not going to be able to go and run a marathon or do all of these things without something breaking down.
And just curious on this person, how much were they running? Do you remember?
They weren't even, because of their pain, they were not currently being active.
Because they just couldn't even handle it.
Right.
Yeah.
Mm-hmm.
I've really learned, on that note, I've really learned that you're kind of always at the mercy of your body, and inputs and outputs matter significantly. And so this is what I really learned with running, was I could run faster if I just trained my body to run faster. And I don't know that protocol that well, which is why I hired a coach to like tell me what to do along the way. But I think when you first start training for something like that, it's super intimidating to think that you can run at this goal pace. Mm-hmm. But then each week you run what coach says to run, and then you notice like, wow, this feels like the same effort, but I'm running faster, or I'm running farther, or I don't feel so exhausted. And I think if you can dial into that as, if you can dial into that yourself, that perceived exertion, like how hard is this? I think that can be very, very powerful, because that's where these 4 pillars really come in is, oh, I ran 2 miles yesterday and it felt really easy, or I ran 2 miles yesterday and it felt really hard, but the paces were the same. Why? And what I've learned as a PT, and I'm sure you have too, is it comes down to how well are they hitting those 4 pillars? How well are you managing your stress? How well are you drinking water and electrolytes with it, keeping those somewhat in balance? How well are you fueling, or how well are you feeding yourself? And what are you feeding yourself? What's the quality of it? When do you eat? All of those can matter, but we don't need to always dive into those small little details. And then the last one, how well do you manage stress? Because I know if you're coming out of a sickness and you go to run, you're like, wow, my heart rate's at 170 and I'm running way slower than normal. What's going on? Your body's still trying to handle the stress of cleaning up the previous sickness. Or I had one guy who came in once who, as he was walking back, he was Courtney's past patient. And as he was walking back, he's like hobbling because his back was killing him. I was like, so what do you think is the cause of this? He's like, dude, my spouse's dad just passed and we're like really stressed at home. And he knew and acknowledged that like my back pain is not because I strained it falling over. It's I am so stressed out right now that my muscles are just clenching down hard. And so it was really, like you said, it's so interesting to like know the facts and know how these things go, but then ultimately see them out in play. You're like, wow, pain is pain is complex, and we don't really learn how to navigate that in school. Coming back to injuries that you normally see, we're going to bring this back. So hip is usually overused. Would you say it's kind of the same thing down the chain at the knee, the ankle, the calf? It's just what body part takes the force?
Yeah, exactly. And the mechanical faults that you see with that, especially when we're talking about runners, a knee injury in runners is almost always because of something from the hip that's not working well, that the knee is getting overloaded, or something the ankle and the foot is not working well, causing issues up the chain, right? The knee joint just connects those two. And so very rarely, unless, you took a big spill on the concrete, which happens a lot.
Touche. Been there.
Yeah, you actually hit and injure your knee. It's not a contact sport, so you're not seeing ACL tears and things like that in just long distance runners.
Yeah.
But yeah, usually always a mechanical fault from somewhere else. But
I want to give you a platform to talk about plantar fasciitis a little bit, because it's really frustrating how many people think they have it or are told that they have it, that it's like totally not the case. So if someone comes in with heel pain, or let's say, so they come in with heel pain, in their paperwork, they just circle the foot and they say, I have plantar fasciitis. Take me through either what you ask, what you see, or how to delineate, this is plantar fasciitis, this is Achilles tendonitis, here's how we need to do it differently. What are those different paths that you'll kind of walk people through and figure out what actually is the heel pain?
Right. Well, I always ask where, because everybody always has plantar fasciitis as one of those diagnoses that people come in with a specific name. Like rather than just like my heel hurts or my knee hurts or whatever, like plantar fasciitis are like, I have plantar fasciitis. And it seems to be used as a blanket term for any kind of bottom of the foot pain.
Okay.
Right. And whether that's because they doctor Googled it, or whether that was because that's what, their primary care, whoever they've seen before, called it. But very rarely is it true plantar fascia issue, right? There's so many structures and muscles around the foot and ankle. And so we just go through and start assessing those. We're going to look at your calf strength. We're going to look at your ankle range of motion. We're going to look at your big toe range of motion. We're going to look at these things that stress the plantar fascia. Does this reproduce your symptoms? We're going to look at things that stress the muscles. Does this, reproduce your symptoms? There can be a big component of like nerve entrapment too that goes around the bottom of the heel that's part of the problem, that is an issue up the chain and not an issue at the heel at all, right? That nerve's getting compressed somewhere. My uncle called me one day and was having heel pain and discomfort. I sent him one exercise to do at home that had nothing to do with the plantar fascia or the foot, and his heel pain was gone within a week, right? I didn't even touch him or see him in person. But I think it's just important to actually dive in and assess all the structures to get a true diagnosis, which you just don't have time for in a primary care office or even in an orthopedic surgeon's office type thing. Like they don't have time.
Yeah, they don't have time
to actually like assess what's going on.
And in my experience, communicating with them and then kind of talking to different friends of mine that are in the medical field, it sounds like they generally don't have the education that we do in this realm. It's not that they don't have education or that they're not smart. It's that they are taught how to be a surgeon or how to diagnose via pictures, MRIs, CT scans, x-rays, or you have the PCP, primary care physician, who they're an inch deep and a mile wide. I always tell people you can only expect so much of them because you go in there with knee pain, but the next person has stomach pain and the next person's dizzy and the next person has a runny nose. Like, I don't know how to solve 80% of those, but I know how to solve you because that's all I do is focus on that. And so if you can get to a person that's going to solve your specific problem, that's where the majority of all of our education is on. That's the person that can actually solve the problem as opposed to just inject it with some cortisone or prescribe a pill type of thing. And so what are 2 or 3 other pains so someone comes in with, quote, plantar fasciitis, and they walk out with a different diagnosis with way more clarity. What are some of those other diagnoses that you would end up kind of throwing out there at them? Like, what are those other structures that are affected?
Yeah. And I honestly steer away from giving people specific diagnoses a lot of times, unless I feel like it's someone that like wants that, right? Because you'll see people that identify with this diagnosis for the rest of their life. Like if I go in and tell them, I was like, you have, tendonitis or whatever. For whatever reason, we like to hold on to these things. You'll get somebody that comes in and they're like, oh yeah, I have patellofemoral syndrome at my knee. It's like, when was that? Do you have knee pain? Well, no. How long ago were you told that? Well, 25 years ago. And it's like, but you like hold on to these diagnoses.
They like identify
so,
and label it so strongly.
Yeah, so I like to explain the problem to people rather than just give them a medical diagnosis, because then for the majority of us, we're going to go and Google it, and there's a lot of iffy information on the internet, right? And so just looking at so much of foot pain is calf issues, calf muscular issues, whether they're just not functioning well, whether they're weak as heck and runners put a lot of demand on them, things like that.
Okay, so you're normally seeing calf weakness. What do you normally see at the ankle? You said you took some range of motion stuff there. What do you normally see there? As a problem, I guess.
Going back, well, very rarely do people have true like ankle joint issues.
Okay.
Right? So talking about the bones that sit together. That's very rarely a problem. And if it is, then we go in and immobilize the joint and do some different stuff there.
Okay.
But a lot of times it comes back to still the calf musculature, those other accessory muscles around the ankle that cross the joint. And if they're not functioning well, they're going to lock down the ankle, cause pain. Some people do have tendonitis. I just only sometimes tell them that's what it's called.
I mean, the way I look at it too is like, I really enjoyed what you said back on. Most of the time what we see is the musculature, it can't handle the capacity or doesn't have the capacity to handle what you're placing upon it. And I think the challenging part with running that I experienced is it's very easy to just go run. The hard part is managing volume. It's like such an easy thing to go start, but you don't know how much is too much. Where if you're squatting, which is more my background of weightlifting, like if I put 200 pounds on the bar, you know really quickly whether or not you can handle that. Like, can I pick up this weight? Yes or no. With running, everybody can generally start the running, but it's, hey, you're running too fast, or you're running too long, or you're not taking enough breaks. And you don't really know that you did too much until later that day or the next day. And sometimes you're like, oh, that's soreness. And you just keep going. And then you have these chronic issues ultimately. So I do appreciate that you batch them more in, hey, here's some weaknesses that we're going to make stronger, and that'll solve your problem. Like you said, not giving them a diagnosis, which I think is very against the grain, but also very helpful for the majority of people. I wanted to throw out some other random questions, and then we'll get a little bit more back into the medical stuff before we finish up today. Some of the random questions, really taking a big spin here, is what is your favorite food or snack that you could eat nonstop?
Watermelon?
That is not what I expected. So when I first put this question in, I was just like, oh, we'll just have fun and get to know people. I have gotten the craziest, and not even crazy, but like the most like not what I would expect answers. Do you do anything special, or you just cut the watermelon and eat it?
Just cut it and eat it.
Have you ever salted it?
No.
God, you got to try it.
There's no need to ruin a perfectly good watermelon.
Yeah, exactly. That's why you would salt it and make it 10 times better.
No.
For anyone listening, please let me know if you're a salt or no salt on your watermelon thing. It helps with electrolytes, so it'd be great in the summertime. The other one I got was Smart Pop popcorn. Smart Pop, Skinny Pop? I think it's Skinny Pop.
I think there's both.
Okay, well, you can be smart and skinny, I guess, both. Not what I would expect. Me and Alan, we're the ones like Doritos all day. Like, that's my jam. Doritos or Cheetos. Anything with toes at the end. Cheetos, Doritos, burritos.
Chips don't really do it for me.
Oh, I wish I had that. This one kind of goes back and forth. I don't know if you eat much supplemental type stuff, but if you had to eat some sort of supplement, like a shake, a bar, a cookie, a muffin, do you have any in particular that you really like?
I don't love the taste of any of them. And so I try to not have to need a supplement, but I always go back to the Premier Protein Cafe Latte.
Oh, yeah.
That's already
Straight
pre-mixed, straight from Sam's. Get the box of 15.
Fantastic. Keep it simple. I totally like it. Is there any stories from either childhood, family stuff, college, PT, whatever it may be? Is there any stories that, or let's say one in particular, that you just really enjoy telling? Whether it's funny, inspirational, whatever it may be.
I love telling the story of how I even ended up in this clinic in the first place.
Enlighten us.
Because, sometimes you get rejected, and sometimes you have to get rejected 5 times before they actually tell you yes. And so if you see something
be polite,
you're
persistent.
I want to be a part of this, or, I really believe in this, like, keep asking. Because I had barely even started PT school, I think, when I first emailed Courtney, our owner, and was like, hey, I like what you do. I want to join you. And he's like, yeah, whatever. Like, nah,
yeah, we're not doing
that's not happening. And I would find little reasons to email him throughout my school. I'd be like, I ran my first marathon, and Courtney was out there cheering at one of the mile markers. He had no idea who I was, but I emailed him after and I was like, hey, I love seeing clinicians out in the community. Like, I just ran my first marathon. I want to do what you do. And he was like, yeah, whatever. Like, whoever this lady is. And so I would email him just random questions and things all the time. And, starting my second year, I was like, hey, I want to do one of my clinicals with you. And he was like, we don't take students. And I was like, I'm going to do one of my clinicals with you. Like, I really want to. And he was like, whatever, you're shooting for the moon or shooting for the stars or something. And I just sent him an email before I put in like my request for my final clinicals, and I put him as number one. And I emailed him. I said, just so you know, I put you as number one on my request list. And he said something about how he didn't know that he wanted to take a student. They'd never taken a student before. And then the school emailed me a couple weeks later and said they accepted me. So, and here I am working today.
It worked.
So
if you want to hear what the other side was, I don't remember how early on it started. But there's multiple times that Courtney's like, yeah, we're having Allison. She'll probably be who we hire. She's crushing it. She's awesome. So yeah. And it would just be like little statements like that. So I don't know. Again, I don't know where these timelines match up, but I don't know if he was trying to play hard to get or stringing you along on purpose on accident. But yeah, no, we kind of knew that you were just going to be part of the team along the way. Like, you still have to like do your diligence, right? Your due diligence. But yeah, no, that's kind of how it was. Ultimately, it was like, oh yeah, she's great. She'll be fantastic and coming on. And but that is funny. I never knew. I always enjoy hearing these little stories because I never knew you started so early on and were persistent. I did a similar thing once I found out about him. A little bit shorter timeline on when I heard about him and so on. But that's funny to hear. What's another fun fact about you that most people don't know? Or just a fact? I think all facts are fun.
I don't listen to music.
Yeah, that's weird.
Not when I run, not in the car. My radio doesn't work in the car, so that's part of the problem. But I think people are alarmed at how much silence I can handle.
I think it's envy is what most people probably have, is the fact that you can handle silence so well. We could probably study your brain and mine and, I don't know, learn something about the benefits of silence.
I enjoy music and I enjoy it on in the clinic, but it's on in the clinic all day.
Yeah,
I don't need it on when I go run or whatever afterwards.
I have to have constant noise, otherwise I go crazy. What's one of your proudest accomplishments?
That's a question, isn't it?
Apparently, we're just stating facts on this podcast. Yeah. How proud of yourself are you for running 2 half marathons and 2 5Ks in like 5 days?
It's fun. It's satisfying. It's one of those things that me now, which maybe this is a problem, me now doesn't get as proud as like if I look back at like think of early pre-running me, should be like, what the heck?
It's all relative, I guess, right?
Yeah, like now it's like, yeah, I'll go out and run a 5K multiple days a week just as a regular. And
where you have some people who like the thought of running a mile is bonkers.
Yeah.
So that's one that I think you should be proud of, is that. And then the other one, I lost it. But I think that's a really big one because people congratulate me on running a half marathon, and I'm kind of like you. I'm like, I ran it. Yeah, like what's the big deal? And then you just think about like doubling that, and I did a couple 5Ks in within a 5-day period. So that's quite intense. So I'm forcing you to make that your answer. Okay, in life, I've observed that many people are either chasing a goal, so they're running towards something, or they're running from and avoiding pain. Which one do you feel like you align more with?
Probably mostly chasing a goal. I'm very, very goal oriented. I always have to have something that I'm working towards. Yeah, I would definitely lean towards that one.
Okay.
The most.
Last big one, and then we'll start wrapping things up for today. If you had the power to change one thing about our healthcare system, what would that be?
Just time, and I think freedom of practitioners, like the practitioners having the time to sit there and talk to their patients, because just hearing somebody out alone, I mean, there's studies that have shown just like somebody validating their pain and hearing them out has dropped pain levels like immediately, right? Like that's huge. And just us being able to think for ourselves, right? Which we're dictated so much by insurance companies and big pharma and all these hot topics, but they do play a role in what we can do in the medical system. And so I don't know what the solution is.
But trying to aim for more time for our clients.
Just more time and more of our brain power, more of us like doing what we actually see fit as a practitioner and not just having to do this because that's all that insurance will pay for, or that's all that, that we're allowed to do in the setting that we're in.
For sure. And I know with us as PTs, there's tons and tons of clinics coming up throughout the nation, even just here in Wichita, that are doing more what's called a cash-based or out-of-network physical therapy. So we don't contract with the insurance companies directly, which allows us to, like you said, be at liberty to treat the patient however we see fit and in the best way possible, and not dictated by what insurance will and won't pay for or approve of, which is very liberating. And I know there's a lot of primary care physicians doing the same. Oftentimes it's called either direct primary care, where people can pay directly to the doctor and not even use their insurance. Are you aware of any other parts of the medical system that are doing anything similar to that, or does that seem like the only two so far?
Those are the main ones. I haven't dove deep into it though.
For sure.
Enough to.
Well, if you're someone listening and you know of some other genres of the medical system that are doing something like that, or even if you just know of any providers here in the Wichita area that are promoting this style of care where it's all completely patient first, and even if they take insurance, but if they're very, very patient first, please reach out to me, whether it be on Instagram or some other form of contact, so that I can get them here to have a conversation and kind of get them more exposed so that we can get more people to them and continue to build this better system as opposed to trying to fix the old one. Ideally, we gradually make that a little bit more obsolete and paying directly to the provider whose high quality becomes more standard of care. Is there any more topics that you just simply want to discuss or for more people to know about as we finish up for today?
Just know that you always can get a second opinion.
Yeah.
I think people don't realize that. Like, you don't owe us, you don't owe any of your doctors your loyalty. Like, if you're hesitant or have questions about something that you're told, like, you can go get a second opinion.
Yeah.
Just on your own. Good. Yeah.
For sure. And especially here in Kansas, where at least for PTs, and I think for some other providers, you can start to go directly to that specialist, whether it be a PT or dermatologist or something like that, without a referral from your doctor. You can kind of just go there. And if you're unsure if you can, just call that office. Say, hey, I want to come in. I've got this problem. Do you guys see this? Yes, no. And if they say yes, say, cool, do I need a referral, or can I come just straight to you and cut out the middleman and save time and money? And just at the end of the day, it's a lot more self-advocation. Like, you put you first when it comes to the medical system, and kind of keep pushing on until you get the answer that you're looking for, or some sort of plan kind of on that roadmap. So Allison, I know that we put stuff out on social media with Natural Wellness. Is there any other forms of content that you put out that you want people to come follow you, or do you just want them to come get a second opinion or an initial eval and get their problems fixed?
Yeah, I don't have any other forms of social media or content that I put out. So follow your podcast.
Yeah.
Follow us on social media. And yeah, just come in.
Perfect. Sounds good. So if you are a runner, or if you know someone who is a runner, well, if you're a runner, please come check out our website and see if Allison's the right fit for you to solve your problems. And secondarily, please send this podcast over to a runner, because so many of you guys that run just put up with the pain, which is like mentally super cool, because you can just push through and you're persistent and you're like mentally tough. But gosh, you don't need to. You can run farther, you can run faster, and you can start to hit your PRs if we just eliminate the problem that's causing that pain. So please send this on to them. Give me a follow on Instagram at the Doc Dir. That is THEDOCDIR. If you're not already, please subscribe to the podcast so that we can continue to grow and get more and better people on. And if you haven't yet, also please leave me a rating and a review so that we can continue to grow the podcast. Again, hopefully today helped you learn a little bit more about how to heal without harm.